Yeah, we are live now. So, good evening, delegates and all the participants. Thank you for joining. This is Sahiti on behalf of Shield Connect, welcoming you all for today's webinar. And today we are back with our series Med Mocha Meetup Season 1, Session 11. And the topic is MMA Prescription Writing. So, it's my pleasure to introduce the organizer of this webinar, Dr. Ritu Santwani ma'am. Ma'am has done MBBS, MD, FICOG, FIAOG, AMRCOG. Ma'am is consultant obstetrician and gynecologist, IVF specialist, founder and CEO of 360 Degrees Healthcare Studio, infertility specialist, and also ma'am is also a part of NUHS Singapore, co-founder of MAAM and board member of SWWC. So I welcome you, ma'am, and I hand over the session to you.
Yeah, thank you. Thank you, Sayati. And thank you, Shield Pharma, for providing the platform for this program from last 3 years. So, by the grace of God and my Mata Rani blessings, and of course, with the help of the stalwarts like Deepa ma'am, this program is going very well from the last 3 years. And I'm really delighted to see that the participants will join all across the geography. So, friends, as we all know, related to the abortion, medical method of abortion, there are a lot of queries in our mind. Though we all are giving the prescription, but still, what are the legal formalities? How can we write the prescription? What are the pros and cons? So, to clarify all this, today I invited a stalwart from our fraternity, Deepa Gupta madam, and really thankful to Deepa ma'am that she has accepted the invitation. Ma'am, we are honored to have you with us. So, with this short introduction of the program, I request Sahiti to please do give the formal introduction of Deepa ma'am.
Yes, ma'am. So it's my pleasure to introduce Dr. Deepa Gupta, ma'am. Ma'am is the chairperson of Community Health and Public Awareness Subcommittee of AOGD, member of Safe Motherhood Committee FOXY, honorary assistant secretary of DMA, honorary secretary of IMA East Delhi 2023, executive member of EDGF, director of Muskan Clinic, member of MTP committee in Delhi. So I welcome you, ma'am, and I hand over the session to you.
Warm welcome, Deepa madam. The dais is all yours.
Thank you, Dr. Ritu, for the opportunity. And it's my pleasure to join you. And thank you so much for your kind words. I'll just share my screen.
Yes.
Is my screen visible?
Yes, ma'am.
Okay. So we all are familiar with medical method of abortion, the prescription writing. So what we are going to cover in this talk is a brief introduction of the medical method of abortion, when, where, and who, counseling, prescription writing, and yes, any method is never complete about the after the post-abortal contraception is very important. As we all know, it's a non-surgical termination of early pregnancy using a combination of drugs. US FDA approved in October 2001, and then it was approved by Drug Controller of India in February 2002. It has to be done by a registered medical practitioner, and the accepted maximum age under the MTP Act for MMA is 9 weeks, and previously it used to be 7 weeks. It has to be done at an authorized place where there is a facility of manual aspiration or blood transfusion in case of an emergency, or it can be done at a clinic which is affiliated with approved center for referral of patients in case of emergency. We must have at such clinics, like one standalone clinics I'm talking about, we should have an affiliation with the center which is MTP approved and on their prescription paper, and it has to be mentioned the emergency number, emergency address, and in case of emergency, that has to be the patient, this thing has to be displayed in the prescription, and it has to be the most important part, it has to be displayed at a conspicuous place at your clinic when it is, so that it's visible to your patient. Drug used are, it's a H category drug to be sold on prescription of registered medical practitioner only, and mifepristone and misoprost in combination available as kit form. Who can prescribe this medicine? A registered medical practitioner. He or she has to be a postgraduate or an allopathic graduate or MBBS plain with 6-month house job in gynae and obstetrics, 1 year experience in hospital in obs and gynae, must have assisted 25 MMA MTPs and 5 done independently in a hospital or a training institute, 3 months training in a government affiliated hospital or training, and 10 cases of MMA done under supervision. So a doctor who's duly qualified under the MTP Act can only use these drugs. Then where? The site has to be MTP registered, whether it is a private sector or a government sector. It has to be approved by the district committee, MTP committee there, under the section 4 of the MTP Act 1971. Secondly, at a clinic, up to 9 weeks or 63 days, medical method of abortion, this can be prescribed, the medicines can be prescribed, but it has to show a referral linkage to an MTP approved or MTP certified site. Though these clinics are not approved by the MTP committee, but they have a referral to a MTP certified site. That is very, very important to understand. And the clinic must display a certificate to the effect by the owner of the certified site. As we all know, the advantages are many. It's a non-surgical, non-invasive method, increased accessibility, minimal infrastructure, no need of anesthesia, minimal risk of complication, very effective, success rate is about 95 to 99%, more privacy for the patient as similarly to natural miscarriage. So we all know it has revolutionized the process of abortion in our country. The counseling is very important and the consent is also important. The counseling has to be a method-specific counseling. We have to explain the process in detail to the patient, like as I told, the benefits or the advantages of this method, then the success rate, failure rate, and how we are going to give the drugs, and how many visits the patient may need at the hospital or at the clinic, and how these medicines are going to affect, like how will they act basically, first medicine and day 3 medicine. And again, after 15 days, the patient has to come for the follow-up. And the most important part is we have to tell the emergency number and emergency address to the patient, and patient should be in accessible limit of an appropriate healthcare facility. Like for example, sometimes we get patients like who come to us, doctor साहब दवाई बता दो, abortion का है, दवाई वाला कराना है, और आपने detail history ली, and patient will tell, I'm traveling tomorrow, I'm going to US for a week. Then we don't have to prescribe. That is the important point. We don't have to prescribe medicines to a patient who is not in the accessible limit of appropriate healthcare facility, because once we prescribe the medicine, we become responsible to that particular procedure. And if she goes out and she has a problem, she's not able to access a appropriate healthcare facility, then we are in trouble. So this is very important. The contraindications we have to understand, then special precautions also. She's anemic, hemoglobin less than 8 gram%. There's a confirmed or suspected ectopic pregnancy. There's uncontrolled hypertension, heart disease, any renal problem, liver or a respiratory disease. She is on long-term systemic corticosteroid therapy currently, an uncontrolled seizure, chronic adrenal failure, inherited porphyria, or she is hypersensitive to mifepristone or misoprostol. Very special precautions has to be taken. Be cautious. In case she is breastfeeding, we have to hold the breastfeeding for 4 hours after the misoprostol. If she is she conceived with IUCD, remove IUCD and before giving MMA. Then we have to be cautious in case of uterine scar, LSCS, myomectomy or hysterectomy. A patient with a big fibroid with heavy bleeding. Patient is on antitubercular drugs because rifampicin increases the metabolism of drugs, hence decreased efficacy of MMA in such patients. There has to be a checklist prior to the medical abortion. A very careful, brief history is important to understand her obstetric history, her menstrual history, and any other medical conditions you want to ask. Then a complete physical and pelvic examination is very important. Then we need to rule out contraindications, counseling regarding the method, and probable complication of excessive or prolonged bleeding, incomplete abortion, failure of MMA, and need of surgical method. This has to be explained in detail to the patient, and it comes in the checklist also. Then contraception counseling, day 3rd and day 15, or you can explain it on the day 1st also. We can discuss this thing on day 1 also. Then a very basic investigation, but very important, hemogram, blood group, urine pregnancy test, and ultrasound, TVS if needed. Then the consent has to be taken on Form C. Then Form 1 has to be filled. Form 3, admission register. Form 2 is a monthly report. You have to report every month. And you have to provide an emergency contact and address for emergency. This is Form C. And in case of a minor, then the mentally ill person or a minor, then the guardian has to fill this consent form. And there are forms also with these are the procedure specific. When we tell the patient about the detail of all the things, then we can also make such type of consent or a not plain paper. Like we have explained all the procedure to the patient, and then also we can take a consent on that paper, but Form C consent is must. Then this is Form 1, opinion form of a single gynecologist or 2 gynecologists. But in MMA, single gynecologist, Form 1 is enough. Then this is Form 2. Then again, detail we have to fill completely. In this, the reason for the termination has to be mentioned. And again, reason for termination. And there's a point additional here, the marital status. Whether the patient is married or unmarried, now we can legally do the MTP. This is the admission register. Now the contents of prescription. 3 visits, day 1, day 3, and day 15. Day 1, 200 milligram mifepristone orally. Day 3, 400 to 800 microgram misoprostol, sublingual, buccal, vaginal, or oral. All the 4 routes can be used. And the day 15 to confirm the completion of the abortion. Contraception to be offered on day 3 or day 15. Routine antibiotics are not recommended unless infection. If patient is RH negative, then NTD 50 to 100 microgram on day 1 is to be given. Inform about the warning signs, drugs for pain relief, and if possible, observe the patient for 4 to 6 hours in the health facility. There is an insertion of a new Section 5A in the MTP Act. Protection of privacy of a woman. No registered medical practitioner shall reveal the name and other particulars of a woman whose pregnancy has been terminated under this Act, except to a person authorized by any law for the time being in force. And whoever is not complying with this provision is punishable with imprisonment, which may extend into 1 year or with fine or with both. So there are 2 things in it. We don't have to mention the name of the patient on the prescription. Secondly, if somebody comes to patient's relatives, even patient husband also comes to us, और आप detail बता दो, तो we are legally not supposed to tell, not to reveal the identity of the woman to anyone except we have a court order. So this is a model prescription. You can see I have mentioned the serial number, not the name of the patient. Like in the admission register what we are maintaining, or a register what we are maintaining, we give the number like It's like it's a 14th, like the serial number 14 August 204. So it is the 14th patient, the month I have mentioned and the year I have mentioned. And suppose like 1st January is there. So it will be first patient and January to 1 Jan and 2025. I give my patient's number like this. And we have to take a detailed obstetric history like G3P2A0 with the pregnancy, how much the pregnancy is. And the indication is very important. FOC is failure of contraception. Then a detailed menstrual history, LMP, last delivery when was done. And if any ultrasound have been done, then mention the detail of the ultrasound. First duty comes, I always do this. Patient is advised to continue the pregnancy, but the patient refuses. This is important to mention. Then the basic investigation on the left side, and on the right side, MTP kit, day 1, day 3, how to take, and the follow-up on 14 days. In very clear words to report if any warning signs, and we need to mention the warning signs on the prescription, and all the risk also to the like incomplete abortion, hemorrhage. And then is the patient advised to report in case of emergency. The phone number and the address is the place where you are attached to the MTP recognized center. So misoprostol, the administration should be could be sublingual, buccal, vaginal, and oral. But the fastest onset of action is fastest in sublingual, and prolonged action with highest concentration and the most recommended method. But yes, all methods can be, any of the methods can be used. Like now we come to the antibiotics, whether we should give it or not. Prophylactic antibiotics important or not? No, we don't need to give antibiotic except in case of a nulliparous woman, like maybe you can risk-taking behavior, you can say, then in that case, or you find any infection. Then the recommended antibiotics are doxy 100 mg twice a day for 7 days for a non-lactating woman, and azithromycin 500 milligram once a day for 3 days, or ampicillin 500 milligram 3 times a day for 5 days for a lactating woman. The side effects of the drugs has to be explained to the patient, as in the prescription we described. The very simple, like the nausea, vomiting, or diarrhea, about fever, chills, heavy bleeding, prolonged bleeding, and any abdominal pain. But she needs to understand what is heavy bleeding. 2 pads soakage in an hour for 2 hours continuously. Fever is 100 or more than 100 for more than 4 hours. Or she's complaining of pain, nausea, vomiting, diarrhea, and a foul smelling discharge also, or then in that case, she has to report immediately. She should have an access to 24-hour emergency services. She should also be instructed on how and when to use an additional dose of misoprostol. Antiemetics and analgesics can be given ibuprofen. But the very important part is a small percentage of women, about 3%, may expel products of conception with mifepristone alone. But the total drug dosage schedule with misoprostol must be completed. And we need to explain this in the beginning only to the patient. Now we come to, many people ask the ultrasound, whether we should go for it, whether we don't. I tell about me, I always do an ultrasound for any patient who comes to me for medical method of abortion. But the recommendation is it's not mandatory to perform an ultrasound for all women undergoing termination of pregnancy with medical methods. It's indicated in pre-procedure in cases where you are suspicious of any ectopic pregnancy, or there is history of irregular vaginal bleeding, pelvic pain, or adnexal mass or tenderness you find in PV. There's the provider's uncertainty with the examination, or the patient is very obese, or pelvic discomfort, she's not sure of her last menstrual, and maybe she's lactating, have irregular cycles, or there's a discrepancy between the history and the clinical findings. During the procedure, you have prescribed the medicines and you haven't done the ultrasound, but now patient comes with excessive vaginal bleeding or with severe pain in the abdomen, not relieved with analgesics. So in that case, ultrasound is recommended. And at the end of the procedure, with clinical examination does not confirm the completion of the abortion process, there is continued vaginal bleeding, which is more than the normal menstrual periods, or there is suspicion of continuation of pregnancy. But if we do an ultrasound before the procedure, we are very safe. Ectopic is ruled out. You know the exact the duration of the pregnancy, and I think legally also we are very safe. On the day of she comes, I mean the day 15 when she comes to us, a clinical history of the woman is taken completely. A pelvic examination is done to ensure the complete expulsion of the products of conception. Ultrasound, yes, if needed, and then tell her that her next period may be delayed, but she should come for a checkup if she does not menstruate in 6 weeks. That is to be emphasized कि एक बारी हमने बोल दिया कि आपका कंप्लीट हो गया प्रोसेस एंड पेशेंट उसके बाद पेशेंट को पीरियड्स नहीं आते हैं एंड देन शी इज लाइक सिटिंग एट होम कि डॉक्टर साहब आपने तो कहा था कि अंदर तो कुछ है ही नहीं, अब तो क्लियर कंप्लीट हो गया, तो मैंने कहा आ ही जाएंगे. नो, we need to mention, we can write it on the prescription also. If her next period does not come in 6 weeks, she has to report it to us and provide her with the chosen contraceptive method if she has already not started it. This is a MMA card. This is to be filled in the beginning also, and all the things like what we have mentioned till far, we have it's like everything is explained in it, like the expected symptoms, the risk factors, and when at what time she has to report to the health facility. So it has to be filled, a follow-up card as a MMA card. Post-abortion contraceptive, hormonal oral injectable on day 3rd or day 15. If she opts for IUCD after 15 days after complete evacuation or after ruling out infection. Barrier method as she starts the sexual activity, tubal ligation after the first menstrual cycle, and vasectomy independent of the procedure. Then incomplete abortion, if there is, so failure or incomplete abortion is due to discrepancy in the gestational age, drug combination, or the dosage protocol. Then in that case, we may need to do vacuum aspiration. And in what cases, in what conditions we can give again try for the this misoprostol. If there's a non-viable gestational sac on ultrasound you find, then you can give 600 orally or 400 micrograms sublingually misoprostol. But yes, we have to be very cautious in a case of previous scar, LSCS. Dose of misoprostol is according to size of the uterus rather than the gestational age. No sac is seen on the ultrasound and only the decidual bits are there. Then conservative management, and we have to follow up the patient after 7 days. And if a viable gestational sac, then vacuum aspiration. So key points. Can we prescribe these medicines sitting at our clinic? Yes, we can prescribe, but again, we need to have an attachment to a center, which is MTP registered center. And we have to take an undertaking from them, and we have to display at our clinic at a conspicuous place so that it is visible to the patient. Secondly, we can keep these drugs with us, but we need to maintain a register with the batch number and all, and how much is used, to which patient it is used, we have to maintain a register on which date that it has been used. Availability not over the counter. Yes, friends, mind the word not over the counter. The chemist is not supposed to prescribe to dispense this medicine without the prescription of a registered medical practitioner. But in our country, they are doing it. So we need to see to it, our FOXY organizations, big organizations have to see to it, it is not available over the counter and not without the prescription of a registered medical practitioner. Even a chemist when he's prescribed, when he's dispensing the medicine, even on the prescription, he has to maintain a drug register. Then second point is we need to counsel our patients, counseling regarding the warning signs, and we have to rule out the contraindications. We have to be cautious in some conditions, and patient name is not to be mentioned on the prescription. It has to be only the serial number. And so, dear friends, prescription writing is a science, art of conveying message from prescriber to the patient. Thank you.
Thank you, Deepa ma'am, for such a nice presentation. You covered each and every point, whatever the queries we are having. Still, we have received a lot of queries. So, with your permission, can I take that questions?
Yes, sure, please. Sure.
Yeah. So, yeah, a lot of friends have joined. There is, yeah. So, first question is from Dr. Anu Barwal. Ma'am, what is Form E?
What is?
Form E.
Form E.
हाँ.
नो फॉर्म ई तो आपने उसके लिए अप्लाई किया ना, जब आपने एमटीपी रजिस्टर्ड, उसके लिए वो तो उसके लिए है। फॉर्म इसका एमएमए का कुछ वो नहीं है इसके अंदर। व्हेन यू हैव अप्लाइड फॉर द आई मीन यू वांट टू गेट योर सेंटर रजिस्टर्ड फॉर द एमटीपी, then it is that for the MMA form E is not required.
Hope Dr. Anu, you have got the answer. From where you have joined, Dr. Anu? Good to see you here. Other question is from Dr. Jaslyn Luthra. Ma'am, what is FOC stands for?
Failure of contraception.
Yeah. So another question is also from Dr. Anu. Okay. Is it true that we should not do TL immediately after MMA as it releases prostaglandins which may cause some complications? If yes, what are those complications?
No, but you are doing a MMA method, so why do you want to do a TL? TL is like once you see the thing, the procedure has been completed, then you have to get it admitted. But the very important point is कि whether when the patient is going for a MMA, means patient को उस time पे तो admission उसको DNC नहीं कराया उसने, तो इसका मतलब वो admit तो होना ही नहीं चाहता था. So most of the time, no patient is willing for a tubal ligation immediately after MMA. That is very important to understand.
Correct. Usually after the surgical only, yes. Once, yeah. So another question from Dr. Anu only. If there is no cardiac activity, can we terminate? Still, is it called MTP?
No, it's not.
Then the question is from, Dr. Rubina. She is writing, married woman wants MTP but husband not willing. What to do?
According to the MTP law, we need only signature of the patient, of the female only. Even if the patient is not willing, the relatives are not willing, we can do a method. I mean, we can do MTP with her consent only. But at this point, I just want to add one thing. It's better कि husband या family कोई ना कोई consent दे, because you become safe. Because otherwise वो, I mean, harass कर सकते हैं basically. Legally तो वो कर सकते, but they will definitely, I mean, they may harass you. So to keep yourself safe and to minimize your headache, it's better if her husband or the family, anybody in the family gives consent. So that they don't to your head कि आपने जबरदस्ती कर दिया, कुछ कर दिया.
Yeah. That's very correct. Though these days the girls are also coming to us. Yes, as madam has also mentioned, married or not married is not a mandatory these days. But still, if they are having the partner with them, of course, I feel that at least we should inform the partner of the parents to post on the later on the consequences. Yeah. Kanchan ji has joined from the Kanpur. She is writing good information. Yes, a very nice presentation of Dr. Suganti Velan. Excellent presentation, but I've joined late. Can I get recording? Says you can go through on my YouTube channel and this program is going live on the YouTube. Lot of doctors have joined via YouTube also. Dr. Anu, you can put my name, Dr. Ritu Sanfani, on the YouTube, you get the channel. Then from Dr. Anu is the question, ma'am, what is called if no cardiac activity can we terminate? Should we ask to wait till the cardiac activity comes? I'm not
No, but
getting
why
it.
do you, if a patient comes in a
Yeah,
very early pregnancy and she wants MTP, so why will we tell her to wait for the cardiac activity to come? No. If she's an early pregnancy, तो cardiac
yeah,
activity की wait करनी क्यों है? Termination चाहिए तो जितना time से हो
yeah.
जाए, termination is always better for the patient.
Yes, that's correct. Yeah. Then the question is from Dr. Rubina. Do we need to consent from the unmarried partner also? No guide. Ma'am has already shown. I have just shared.
Yes, yes, yes.
Yeah.
Only her
So,
consent is more than enough.
yeah. Her consent is more than enough. That's why these days girls are coming and telling us, ma'am, we have seen this reel, we have sent this reel. So in that, all the things are mentioned. Yeah.
And
Thank
but
you,
I
ma'am.
just want to add one thing here, Dr.
Yeah.
Ritu.
Yeah.
I mean, we have time now. अगर मैं एक incident बताऊं अपना एक patient का तो.
Yes, ma'am. Yes, ma'am, please.
I have a unmarried girl. She came to me in 2022 COVID time पे for MTP. ठीक है?
Okay.
तो she never told me कि she's unmarried and COVID में तो हम थोड़ा सा जल्दी history लेते थे and all. I did an ultrasound everything and I did an MTP और उसके जो form था या उसमें the husband का नाम उसके boyfriend का नाम था but that time I had no idea कि she is unmarried. ठीक है? Then she committed suicide after 1.5 years.
Oh.
And the police found my prescription at her house and they came to me. ठीक है?
Okay.
तो एक तो सबसे जरूरी चीज जो हो गई कि when they came to me with the prescription and they wanted कि डिटेल कुछ बता दो तो first thing what I did was I said कि sir I want a proper मतलब एक कोर्ट नोटिस हो गया या आपका उसका हो गया प्रॉपर then only I will reveal anything otherwise I will not. So he went back and he brought the legal papers to me and then only I replied it like in written only. So that was important to what was asked from me and I properly in a legal paper, I answered that question. That was because I became very safe accordingly. I wanted to tell you. And secondly was कि मतलब अगर पेशेंट मतलब हमने तो उसके हस्बैंड के साइन करा लिए अब हमें तो पता ही नहीं था कि वो मैरिड है या अनमैरिड है तो इन केस इन दैट पर्टिकुलर टाइम अगर सिर्फ लड़की के साइन होते और लड़के के साइन नहीं होते तो हम कभी भी ये नहीं बता सकते थे मतलब आई वॉज एबल टू टेल देम कि यस दिस बॉय केम टू विद दिस नेम एंड ये रजिस्टर पे मैंने साइन भी दिखा दिया अदरवाइज साइन नहीं होते खाली लड़की के होते तो उस लड़की को जस्टिस नहीं मिलता कि कम से कम उस लड़के की इन्वॉल्वमेंट नहीं पता चलती क्योंकि प्रोबेबली शी कमिटेड सुसाइड बिकॉज शी वॉज इन live in relationship with that boy and he refused. She had multiple miscarriages. I mean, multiple MTPs after she came to me 1.5 years. तो कई बार it becomes important अगर कोई भी साथ में है तो उसका भी आप साइन ले लेंगे तो it's always good.
Yeah. Our safety is in our hands. Yes, sometimes
Yes,
it
exactly.
happens.
Absolutely, absolutely.
Sometimes it happens. We are also in hurry, and sometimes a lot of rush in the OPD. That time, patient is also insisting, "Ma'am, do it quickly, do it quickly." So, thank you, madam, for enlightening all of us. I am able to see Renu, madam. Madam, good evening. Renu,
I
madam has
just
joined all
wanted
the
to
way
add
from
one thing. Yeah, I
Yes,
just
hello,
wanted to
ma'am.
add one thing. It is
Yes,
always
ma'am.
necessary, as she told us, to take the sign of a person or assistant or guardian and so on. In unmarried girls especially,
Yeah.
I always call the mother to come and sign because there was a case where the girl had bleeding after MTP and the boy ran away. Then the doctor was caught very badly. She has to do everything arrange and she was called in
Just a
court for
second.
that case also. So it is always better to call somebody and take the consent and then do MTP.
Saiti? Saiti, are you there? Sahiti? I don't know why Sahiti is not responding
Yes,
me.
ma'am. Yes, ma'am. I'm here only. Just I'm sharing the
Yeah,
screen.
Yeah. Ma'am, we have got lot of good comments. Dr. Rosie Sharma always joins my webinar from Bhutan. She is. I'm able to see Dr. Samuel also. Ma'am, this is a small token of appreciation from our side. Certificate of appreciation for contributing as a distinguished speaker. Thank you, ma'am. Thank you, Deepa
Thank
ma'am.
you. Thank you, Dr. Ritu. It was very great to be
Okay.
associated with you.
Thank you, ma'am. Sorry, Rosie. Sorry, Rosie. Yeah, Rosie is joined from the Nepal. I was because the bell was ringing. That's why.
Okay.
Yeah. Okay,
That's good.
Poonam madam has also joined. Yeah, okay, Poonam madam, you will get on my YouTube. You can go through my YouTube. You will get all the details. Yeah. Okay. Yeah.
You're
So
doing
with
good
this,
work, Dr. Ritu. बहुत अच्छा work. You're wonderful. बहुत अच्छा आपका.
thank you, ma'am. Hi, Asha. How are you? Uh. So many doctors have joined. Dr. Asha from Kanpur. Correct, na, Asha? Dr. Asha? As I remember. Dr. Samuel from Africa. Yeah, hi, Dr.
Namaste,
Samuel. How are
Oh,
you?
ma'am.
wow.
Namaste. How are you?
Namaste, ma'am. Fine, thank you, ma'am.
Namaste.
Namaste, ma'am.
Namaste. Okay.
Dr.
Actually, Dr.
Preeti Gupta from Delhi, my friend has also joined.
Okay. Great. Welcome, Preeti ma'am.
Dr. Ritu, आप muted हो.
Oh. Acha. So we had discussed today what the guidelines are in the India. So friends, with this we will wind up for today. And my next webinar date is on the 18th. I will post the flyer tomorrow. I will post it. Yeah. So with that, we will wind up for today. Thank you everyone, and thank you once again, Deepa ma'am.
Thank you, Dr.
And thank,
Ritu. Bye.
and
Good
thank you,
night.
Shil Mama, for providing the platform from the last. Whenever I ask them, Sahiti and Shil Pharma will never say no to me. So thank you once again, and bye-bye to everyone.